Dark side of obesity drugs like Ozempic, Mounjaro, Wegovy, and even Zepbound. I am Dr. Amit Ergin. I'm a hormone specialist and endocrinologist and metabolism expert. Today we are talking about the obesity drugs that you need to know. Did you know that there are millions of people right now out there taking these obesity drugs? They're actually diabetes drugs, but some of them are obesity drugs at the same time. Let's be real, are they abusing them? Maybe not, depending on how you look at it. But you've got these names like Ozempic, Mounjaro, Wegovy, and the new kid on the block, Zepbound, right? But hold up, there is a dark side of these weight warriors that we need to chat about. So back in January 2023, when the GLP-1 receptor agonist semaglutide got the green light for weight regulation, it was like a whole new era of obesity therapy was born. Exciting stuff, right? But here's the catch. In more recent months, regulatory authorities have been documenting some rare and occasionally severe side effects tied to these agents in diabetes therapy, and your doctors might not have been fully aware of them. A lot of patients don't mind because as long as they lose weight, they don't mind if there's a risk of dying or some cancer or some whatnot, because weight loss is very important, isn't it? Yeah, that's what they think. But listen up. These GLP-1 receptor agonists like semaglutide or liraglutide mimic certain intestinal hormones. Good for diabetes typically, and with side effects, but most of their trademark side effects are related to your guts. Think like nausea, vomiting, constipation, or diarrhea. These are the innocent side effects. Nothing. But wait, there is more. We are not just talking about those run-of-the-mill tummy troubles. Nope, there is a whole range of rare, severe side effects that are quickly gaining some serious attention. So hold on to your stomachs, folks, because we have got some serious tummy troubles here. A recent study published in JAMA, if you're a doctor or a nurse, you will know this, a famous journal, had the audacity to reveal that the GLP-1 receptor agonists, those fancy weight loss medications, and fancied by a lot of diabetics due to weight loss as well, are linked to a whopping ninefold increase in pancreatitis risk. And that's not all. Patients on these medications also had 4 times more intestinal obstructions and over 3 times more cases of gastroparesis. Yikes, right? But hang on, there is some good news. The absolute risks for these complications are less than 1% per year of use, but 1 of the 100 will be doomed. So, while it may sound scary, you are still talking about a slim chance of running into these problems, so I'm not saying these drugs are totally evil. You have to be careful. And don't you worry about the gallbladder. Yeah, right? Some of you have gallbladder issues. The risk also depends on what's your beginning risk. If you're a high risk for gallbladder or pancreatitis, adding these drugs will be even more trouble. So 1% is for general population, but if you are a high risk population, your risk may be up to 20, 30, or even 50%. Now, let's switch gears to a different kind of trouble. Fast forward to the spring of 2023. Where reports started surfacing about patients taking GLP-1 receptor agonists and experiencing some rather unpleasant surprises during anesthesia. Well, that one is scary. Now picture this. People vomiting like there is no tomorrow, even though they followed their pre-op instructions not to eat anything. And then guess what? When they are intubated, there is a high risk of aspiration and then pneumonia, and then septic shock and death, all possible. Experts think this might have something to do with the GLP-1 receptor agonists messing with the gastric emptying. Kinda, you already know that by now, right? Because you're watching this video and you're loving it. So, did you already subscribe? I bet you did. Are you gonna share this video? I'm sure you will. In light of this, the American Society of Anesthesiologists has kindly advised patients to steer clear of GLP-1 receptor agonists a week before the surgery. And for those taking those weekly administered guides like the Wegovy and stuff like that, really, you have to skip at least 1 or 2 doses before going under that knife. Oh boy, buckle up for this one. Let's talk about the not so fun stuff. There are some reports of depression and thoughts of self-harm in patients taking liraglutide or semaglutide, like Ozempic or Wegovy. They're still investigating about 150 cases, and we are all eagerly waiting for the results. It is still unclear if these drugs are causing the problem, but similar issues have been seen with other weight loss medications. If you've got a history of feeling low or having any thoughts like that, it might be a good idea to tread carefully with these meds. Better safe than sorry, right? Especially if you have family members on these meds who are also depressed. Now, here's the interesting bit. It turns out that these GLP-1 receptor agonists might need to be your buddy for the long haul if you want to keep reaping their weight loss benefits. We are talking about potentially lifelong commitment. But here's the kicker. We don't really know all the potential side effects and complications that might actually show up after a while, especially when these drugs are used for weight reduction for a decade, which we have no data about. Remember, the saying, out of sight, out of mind. Well, that applies here too. In mice, there's been a hint of an increased risk of thyroid carcinomas, but we are not entirely sure if humans will follow suit. Only time will tell, my friend. So, if you or anyone in your family has dealt with, especially medullary thyroid carcinoma, you definitely need to steer clear of any of these agents, including dulaglutide like tridolicity, or liraglutide like Victoza, semaglutide like Ozempic or Wegovy, or tirzepatide like Mounjaro or Zepbound. These ones are a big no-no for you. On a brighter note, if you are ready to level up your game, there is a dual agonist called tirzepatide, or even a triple agonist, which is coming up, called retatrutide. So these babies offer some serious weight loss potential. But hold on tight, because as with any good thing, there are some pesky gastrointestinal events that come along for the ride. Trade-offs, right? So there you have it, my friend. The ins and outs of these weight loss drugs and what you need to know. Most of them are also diabetes drugs. Stay curious, stay informed, and keep that smile on your face. You got this. Thank you. I'll see you in the next video. Remember, subscribe to HolisticMD, like, share, and subscribe. Talk to you later.